Cancer is just something that we all have to recognize, acknowledge, cope with, live with, struggle with, rage upon, crush, and even thrive with. This show is more than knowing and fighting or beating cancer. It's more than just relaying science, hope, and technology. Together, our purpose is to demystify cancer, take away as much fear out of the diagnosis, treatment, and process as we can, defeat its grip on our lives. This is The Cancering Show. Welcome to The Cancering Show. I'm your host, Dr. Jennifer Young-Pierce, and today we're diving into a groundbreaking advancement in cancer treatment. Our guest is Dr. Natalie Bath, a surgical oncologist at USA Health, who's going to introduce us to Histotripsy, a cutting-edge, non-invasive technology that uses focused ultrasound to target liver tumors. We'll discuss how it works, its accessibility, patient experience, benefits, and much more. This is a very big deal. We are super excited to be looking at this new option in cancer care. I'm excited to bring this to y'all, so listen up. Let's dive in. Dr. Bath, welcome to the show.
Hi, thank you for having me today.
So we have to start with the basics. Tell us a little bit about yourself as a surgical oncologist.
Sure. So I'm, like you said, a surgical oncologist. I treat mostly patients with liver and pancreas cancers, but also other GI cancers. And so, focusing on treatment of liver tumors is a large part of what I do.
Okay. And so tell us about this histotripsy. I know it's a big deal for us.
It is. We're very excited about it. We will be getting our machine shortly, and it'll be the first one in the state of Alabama. And so this machine treats liver tumors by using ultrasound waves completely externally to destroy the tumor cells only. It actually preserves other liver anatomy. And so the fact that it doesn't involve any type of skin incision, no probes are placed inside the patient, it's completely non-invasive. And so we're very excited to be able to offer this to patients. That's
incredible. And tell us why we are the first in Alabama. Why was it so important to you to get this treatment here?
So our Department of Surgery and Interventional Radiology, they are, very large proponents, I think, adopting and being early adopters of new technology. If you kind of go back through, from a surgical history standpoint, being early adopters of laparoscopic and the robotic surgery, I think is something that's been very important to this department. And so histotripsy is kind of a new advent in that as well. And I think, everyone within both departments are big advocates for patients. And so this being a new modality to offer to patients who otherwise may not have other treatment options, that's something that's very important to us.
Absolutely. And can you give us a little layperson's crash course in how it works?
Sure. So patients are seen in clinic, patients with any type of liver tumor. And then we get a liver ultrasound done in order to make sure, because that's how the machine itself targets lesions, is using ultrasound. Patients are placed under general anesthesia, and that's just to help control with movement during the procedure itself. And then we use an ultrasound to find that lesion again, and we are able to target it with the ultrasound, and then it destroys the tumor with a very small bubble cloud. And like I said, preserves other liver anatomy. And then patients are actually able to go home the very next day and resume their normal activity.
That's incredible. Can you just tell us how the sound waves liquefy the tumor?
So that's a good engineering question. So there's some type of the frequency, I think, at which it vibrates. It's able to expand and contract cells very quickly. And so with that frequency that it operates at, it's able to selectively target tumor cells and leaves normal liver tissue alone. And so by that expanding and contracting, it destroys the cells that we're trying to target.
Very cool. All right. And so when we're trying to choose as physicians, there are other ways to target liver tumors. We have done radiation treatments in the past. We have done embolization procedures in the past. How do we choose which one of these treatments is the right one for a patient?
Yeah, so that's a really good question and has, a lot of complexity to it. But I think, generally speaking, kind of think about, our patients' surgical candidates, in which case they need to be, healthy enough to withstand a liver surgery. A lot of it also has to do with the anatomy of the patient. If the tumor is located to large blood vessels or to bile ducts, And so if patients aren't surgical candidates, then we think about different interventional radiology techniques, such as an ablation, which is where you go in through the skin with a probe and basically burn the lesion. And so with small lesions, we're able to use different ablation techniques to target the lesions. And then for bigger lesions or with patients that their liver function overall is not as healthy, then we think about doing things such as, Y90, which is delivering radiation directly to the tumor itself. And so there's a lot of different options. A lot of it has to do with, a patient's overall health and the overall health of their liver itself.
So tell us kind of what recovery looks like. Do patients get follow-up scans? Do they potentially need follow-up procedures?
Yeah, so patients will go home usually the same day with it not being invasive at all. Some in the studies in which we've studied histotripsy, some patients may have, a little discomfort at the site of where their tumor was targeted, but otherwise patients don't have to go home with any pain medications, usually just Tylenol or ibuprofen for recovery. And then we will get a CT scan within 24 hours of completing the procedure in order to make sure that there's no complications or any abscesses or any complications related to the procedure itself. And then we'll see the patient in clinic about a month after that, just to make sure everything continues to go well. And then we'll get another scan in 3 months to make sure that we've been able to completely target the lesion that we were aiming for.
And there's a lot of different liver tumors. There's the ones that grow in the liver primarily. And then, of course, as a GYN oncologist, I think about using this for patients with metastatic cancer, of course, for lots of our colon cancer patients and things like that. Does it matter if it's primary hepatocellular liver cancer versus metastatic?
Yeah, so that's a great question. So the great thing about histotripsy is it actually can be used for any type of pathology. So it's really agnostic to the type of liver tumor that you might have. This has been used on patients with hepatocellular carcinoma or tumors that have started in the liver. And then it's also, I think, been really great for patients that do have metastatic disease, either from some other tumor that has then spread to their liver. And these are patients that, otherwise maybe we would have said they wouldn't have had any options to move forward with treatment, but histotripsy has, offered patients additional treatment options outside of surgery and outside of other local regional therapies.
That's really incredible. And it's just when I think about the advantages for our patients and things like that, thinking about how that changes your life to be able to just have this outpatient procedure instead of a big surgery for your cancer treatment. It really is incredible.
Yeah, absolutely. With surgeries, patients can be in the hospital, for anywhere from, a couple of days to a week. Even with the other, more minimally invasive procedures that, interventional radiology can watch, sometimes patients do still need to be, monitored in the hospital. I think one of the great things actually about histotripsy as well is, a lot of these patients that we see are on chemotherapy or on blood thinners for whatever reason. And with this, technology, we're actually able to continue patients on those medications while they're receiving the treatment. Whereas with other, with surgery or other procedures, you'd have to hold those medications.
Right. Thank you for addressing that. I was going to ask that next, especially things like the immunotherapy. I think we do think about and we've talked on this podcast about the way that immunotherapy and radiation work together. Do you feel like this would have a similar benefit in terms of providing antigens to kind of stimulate the immune system?
Yeah, I think that's a really interesting question, and actually one that, they're continuing to study in the ongoing studies that they have with histotripsy. I think, one of the indications for histotripsy is also to be able to help bridge patients to liver transplant.
Okay.
And so by being able to target one lesion, you're able to, hopefully bridge them to transplant. But there's also been some reports of a, tumor immunogenic, effect, kind of what you were mentioning. If patients have disease that's either outside of their liver or if they have multiple spots within their liver, we have seen that those other spots that were not necessarily directly targeted with the histotripsy, they've actually gotten smaller as well on subsequent imaging.
Yeah.
And so I think that's something that, we really need some more, data to see whether that's something that will, continue on long term for patients. But certainly, the results that we have right now are very, very promising, and that, by liquefacting the tumor, basically you are exposing your body to those tumor antigens with the goal of, ramping up your immune system against the cancer.
Awesome. And when we think about using this in patients, we think about long-term side effects. And are there any things that patients should be looking for, not just the day after the procedure, but days, weeks, or even months later that would be worrisome to you?
So really, it's just, kind of making sure that patients don't develop fevers. The biggest complication anytime you're treating the liver would be developing some type of liver abscess or, potentially developing some type of, infection of the bile ducts. And so those are things that really we would see, I think, more in the short term. We are continuing to gather data on kind of what patients look like, long term from this. But really, once they get out of a couple of week window of the procedure itself, there's not a whole lot of, long term consequences of this.
Awesome. And I know my patients are going to ask me, Doctor, I just saw on the news that it's brand new. Is this an experiment? Is this research? But as I understand it, this is an FDA-approved treatment.
It is, yeah. So it was FDA approved in 2023. It started, at the University of Michigan. And so they've been studying this, for many years in preclinical models and now is FDA approved. They actually just finished their first or have 1 year results on their Hope for Liver trial just earlier this year, which showed, equivalent cancer outcomes between ablation and other liver-directed therapies and histotripsy. And so I think the exciting thing is, as we get further out from when those patients were first treated, we'll have more and more data, I think, to support, its long-term use, which I think, will just continue to open doors for more and more patients to be able to undergo this.
Absolutely. And as we're new, I assume there's a group of patients that aren't great candidates for this treatment. Do you want to go through that so that not every patient calls you or that not every doctor calls you with a patient who happens to have a liver tumor?
Right. And so I think, so for the most part, I think, patients can be candidates from a technical standpoint for histotripsy. But as a, cancer surgeon, my biggest, concern and my goal is to make sure that we're providing, excellent cancer care to patients, meaning that we're not putting you, through the procedure that we're not sure about long-term results. And so I think this is mostly for tumors that are less than 4 centimeters, and then also making sure that we're able to see the lesion on an ultrasound at bedside, because that's how we target the lesion itself. I think for a lot of patients, even if, histotripsy is not an option, we have a lot of other different, modalities such as surgery, such as interventional radiology, techniques to treat liver tumors. And so I think there's a lot of patients that are, given a diagnosis of either stage 4 cancer that's spread to their liver, and they aren't necessarily aware that there are options to be for treatment. We don't just say, there's nothing that we can do for you.
Sure.
We have a lot of options for those patients. And so I think, I'm excited to see, to offer more things to patients for treatment.
Absolutely. And I think this is so important. And I have this conversation with patients every day. Patients think the second they hear that they have metastatic disease, that that's it. The jig is up, that they're on the clock. And that means there are no treatments. And there's so much that we do now for patients who are living years and years with even stage 4 metastatic cancers at diagnosis. And we want patients to know that there are treatments available, and that sometimes includes things like chemotherapy, but sometimes is this very targeted therapies that we don't want them to turn down treatment and miss out on an opportunity for a treatment that really could not just treat a symptom maybe, but also could help to control their disease for a longer period of time.
Yeah, I totally agree with that. I think, maybe 20 years ago, it might be the case that, we didn't have as many options for patients. But I think, with how, chemotherapy and other agents have really improved, that's given us a lot of different options. And now we're able to, offer different procedures to patients to help, control disease and control symptoms. And I think that's something else that, histotripsy is also good for patients that might have tumors that are located near bile ducts. And so if that tumor continues to grow, then it could potentially cause, an obstruction of that bile duct. And then you need many different
time
procedures.
Is short. Right. Or you need a ton of procedures.
Right. Yeah. You need additional procedures. And so I think if we can prevent that growth from happening or prevent that, obstruction from happening, that's something that's, really meaningful and important, I think, to patients in their cancer care.
Absolutely. And question for you. Can patients have this procedure more than once?
Yes, absolutely. So usually we just target, 1 or 2 lesions in one session. One session itself lasts about 45 minutes to an hour. But in the future, if either patients have additional, lesions that we know at the time of original treatment, or if they develop new lesions, this is something that can be done, multiple times.
Okie doke. And I'm asking myself, could this technology be used to target other tissues in the future?
Yeah, so it is FDA approved for liver tumors. They are currently working on FDA approval for kidney tumors. And so I think that's something towards the end of the year, they're looking to have approval for that by then.
Wow.
They're also looking at, treating for BPH or prostate issues in men. It can potentially be used for that. In Europe, they're conducting trials on pancreas tumors. And so I think, we're really kind of at the forefront of it. Fortunately, we have it for liver, but there's actually a lot of different other indications that are, really just on the horizon.
And potentially opportunity to do those trials here at South.
Right, exactly.
Yeah, I love it. And, we talk a lot about advocating for yourself on this podcast. And I just want to say to the patients who are listening to this to ask your doctor, whether you have a liver tumor or not, ask your doctor about multimodal therapy. We talk about this all the time, that we're not just using one thing to treat cancer these days. We're using chemo, radiation, these incredible techniques of targeted treatments. We talk about targeted oral medications. And of course, as always, talking about immunotherapy and the way that these newer targeted kind of zapping modalities can work with the new immunotherapy. So always get out there and advocate for yourself. Ask your doctor if there's anything else that could help me with my cancer. So for the people who are kind of trying to learn more, where would you send them for more information?
Sure. So you can online, if you search for USA Health Histotripsy, I think one of the first things that will pop up is a link that goes to our website. It explains a little bit more kind of what we've been talking about today as far as what histotripsy is and how it works. And then there's also a form attached to that where you can enter your own information so we can get in contact with you and see if, histotripsy might be a good option for you.
Excellent. And we can't wait to hear how it's going a year in.
I know. It's very exciting. We'll have our machine at the beginning of August. And so hopefully we'll start treatment around there. So look forward to reporting back our findings.
Awesome. Thank you so much for coming in the studio, Dr. Bath. It's great to talk to you.
Yeah, of course. Thanks for having me today.
I am so excited about this new technology and what it means for our patients. To recap, histotripsy currently is being used to treat liver tumors, both primary and metastatic cancers. So we know that it is available starting here in Mobile, Alabama in late August, and it is available across the country. At least 100 other centers in the country do have this. We're the first in Alabama. But if you are somewhere else, important to ask around or look around, see if this is available in your region. Also, this adds to our arsenal of ways that we can kind of, quote, zap liver tumors, some minimally invasive and some non-invasive. So you also want to ask your doctor about histotripsy as compared to these other older modalities for treating liver tumors. And of course, always ask about how this can be used in a multimodal way. So being used with chemotherapy or with immunotherapy or other targeted medicines. I particularly liked when Dr. Bath pointed out that it doesn't require you to stop a blood thinner or anticoagulation if you are on that, as opposed to some of the other more minimally invasive or even invasive methods for removing or treating these tumors. So always ask your doctor, always get more information. We're big advocates for that, but we are super excited to bring you the information about histotripsy, this new technology that we are the first in Alabama. As for now, thank you for listening. Thank you for being part of our cancering community. And until next time, keep cancering and take care of yourself. Thanks again for listening. And don't forget to submit your questions at www.cancering.com. We're here for all of those questions and we'll get you the answers. This show is brought to you by the University of South Alabama Mitchell Cancer Institute. MCI is a cutting-edge cancer research and patient center built to fight cancer smarter in Mobile and Baldwin County, Alabama. Our researchers and clinicians focus daily on the struggle against cancer, serving a potential catchment population of more than 4.1 million people, with a singular focus of advancing cancer diagnosis, treatment, and prevention throughout the Gulf Coast and beyond with science, technology, and hope. Want to know more about the Mitchell Cancer Institute? Visit us at usamci.com or search for us on Facebook, Twitter, and Instagram. Mitchell Cancer Institute is a member of USA Health. To learn more about all of our hospitals, clinics, and services, visit usahealthsystem.com.